All right, we are going to go ahead and get started. I would like to thank everyone for being out here on this very toasty day in the sun, overlooking, by the way, our gorgeous river and Greenways Park. But I would like to thank everyone for being here to support women in Columbus. Women deserve to be able to access their constitutionally protected healthcare services, and healthcare workers deserve to be able to do their jobs. They deserve to be able to do these things without fear of harassment, violence, and intimidation. Yet the reality we see is far different. In the last 5 years, our city's reproductive health care clinics have seen a 170% increase in police calls, clearly demonstrating a safety concern. The calls were for reasons such as disturbance, assault, vehicle obstructing, and security needs. This data provides a glimpse into what is occurring on the ground. In fact, it tells just a portion of the reality that Columbus residents face when seeking access to reproductive health care facilities. If our existing laws were sufficient for dealing with the situation, then the swelling numbers of harassment and intimidation would not be occurring. That's why we're here today. At our Columbus City Council meeting this evening, we will consider Ordinance 1458-2016, the Healthcare Worker and Patient Protection Ordinance. If enacted, the ordinance prevents any person from doing the following: preventing access to reproductive health care services, physically obstructing or blocking another person from entering the clinic, following and harassing another person engaging in disorderly conduct and harassing behavior within 15 feet of the facility, and or behaving in a way that places another person in reasonable fear of physical harm. Violation of any of the above is a misdemeanor of the first degree. Joining me here today are a few people you will hear from at the podium. I'd like to start with Kayla Merchant. Kayla is a resident of Columbus and a former patient of a reproductive health care facility.
Good afternoon. The genesis of this ordinance is not an attempt at restricting the freedom of speech nor the freedom to assemble. This ordinance is intended to afford privacy, safety, and respect to the doctors, nurses, patients, and volunteers at women's health care clinics. 2 years ago, as I entered Founders Women's Health Center, I was surrounded by individuals who had no idea why I was there that day. They had no knowledge of the purpose for my visit and were unable to ascertain whether I was a doctor or a patient, or whether I was there for an abortion consult or for a family planning session to discuss birth control. That day in October, I was a patient and I was a terrified woman with a heart condition that, in conjunction with the pregnancy, was endangering my health. And as I walked to the entrance, I was swarmed by men, women, and children, and I could feel their breath on my neck while they called me a murderer, telling me to cease my whorish ways. I resisted every urge in me to react while they held a video camera in my face, obstructing my path to the door, walking alongside me with their hands on my arms, trying to dissuade me from entering, and recording each step that I took toward the door. Their literature brushed against my cheeks repeatedly as I tried to maneuver my way safely to the door of the clinic. This ordinance, however, isn't about abortion. This ordinance is about the right that is owed women to seek healthcare services of any sort without undue harassment from third parties who are in no way stakeholders in their decisions. What if I were a young girl who was scared that I might have an STD? Would I even make it to the door? Would I seek treatment if I were being harassed in a manner that my developing mind may not be prepared to handle? The answer to this is most likely no. If I were a scared young girl with an STD, my disease might go untreated, and I would be led to believe that because I am a woman, I don't have a right to seek healthcare services without retaliation from strangers. And some may say their only intention is to pray in front of the clinics. I ask that if you not previously witnessed the malicious, invasive harassment that doctors, nurses, technicians, volunteers, patients, and their families are subjected to, that you visit one of our local women's healthcare clinics on a Saturday morning, as I did in October 2014. This ordinance does not ask for a restriction that would be burdensome to those who oppose it. Only 15 feet. We only want 15 feet so that we may walk peacefully, free from threats, whether actual or perceived, to the door of a facility that provides us the healthcare services we need. And today we respectfully ask for space to breathe. We asked for space to exist. And today we're asking you to approve this ordinance so we feel safe when we are at our most vulnerable and that we feel protected when we may not have the strength to protect ourselves. Thank you.
Thank you so much, Kayla. Next, I'd like to introduce Bob Stewart, who is Assistant Director of Public Safety, to provide comment regarding public safety.
The role of law enforcement in this is very simple. We are supporters of the First Amendment, but at the same time, what we're there to do is to make sure that the law is followed, that rules are followed. It's I'm not lessening this, but it's similar to driving down the street and running into a construction project. The officers are there to make sure people and vehicles get through a particular area safely and without harm. Here is a very similar thing. We're there specifically to enforce the rules. Officers are trained to deal with various forms of intimidation, but we're not there specifically for that. We're there specifically to make sure that mediation takes place if it needs to, but that the law is explained to those who need to be reminded. Again, we're not there to take sides. We're there just to make sure that things happen properly and legally.
Thank you so much, Assistant Director Stewart. I'm also joined here today by three of my colleagues, Council President Zach Klein, Council President Pro Tem Priscilla Tyson, and Council Member Other Brown, Mitch Brown. And I would, if they have anything that they would like to add, I'd like to offer the podium. Okay. Thank you so much. I want to make very clear that this ordinance protects constitutional rights of all varieties. We are protecting the constitutionally protected right of women to access healthcare services. We are also protecting free speech. Within the 15-foot zone that this ordinance establishes, a person is allowed to walk, is allowed to pray, is allowed to engage in a conversation with women. Where we draw the line is harassment, intimidation, and violence. And this ordinance makes clear that that will not stand in the city of Columbus. Women and healthcare workers in Columbus do encounter harassment and intimidation when they try to access legal reproductive health care or do their jobs. Such behavior should not stand in our city. We are not a community that allows extremists to interfere with women's health in a violent manner. That is why I am confident that tonight's healthcare worker and patient protection ordinance will pass. I want to open it up for questions now. And as I do, I'd like to point out a few people behind me who will help to answer questions if relevant. I want to start with Jamie Miracle of NARAL, Pro-Choice Ohio. We have Melanie Tobias from the City Attorney's Office. We have Dr. Teresa Long from Public Health. We have two state legislators here, Kristen Boggs and Greta Johnson. They were supporters, and Kristen was a co-sponsor of House Bill 408, which aimed to do a similar thing at the state level. And I didn't forget anyone. And there's Iris who's hiding behind Greta. We have Iris Harvey, who is the CEO of Planned Parenthood Ohio. So I'd like to open it up for any questions. Okay, thank you.